Hello, I'm Paulo Caramelli. I'm professor of neurology at the Faculty of Medicine in the Federal University of Minas Gerais in Belo Horizonte, Brazil. And I will talk to you about the impact of social isolation due to the COVID-19 pandemic on people with dementia and their family caregivers. So people with dementia and their family caregivers have been facing a great burden through social isolation due to the COVID-19 pandemic, which can be manifested as several behavioral and clinical symptoms. This situation is especially challenging in low and middle income countries and regions such as in Latin America. A few months ago, we designed a study to investigate the impacts of social isolation due to the pandemic on people with dementia, on their family caregivers in 3 Latin American countries, namely Argentina, Brazil, and Chile. So we designed 2 semi-structured questionnaires, one directed to the caregivers and the other to the people with dementia, to assess clinical and behavioral changes in people with dementia and in their family caregivers. These questionnaires were administered by telephone interviews from May to July 2020 to family caregivers of people with dementia followed at 5 outpatient clinics in Buenos Aires, Belo Horizonte, and Santiago. People with mild, moderate, or severe dementia of any etiology and with any age were invited to participate, and of course the study was approved by the ethics committee of all institutions. So here you see the social demographic and clinical characteristics of the study participants in the 3 countries. Overall, 321 people with dementia and their family caregivers participated. As you can see, there were no differences in relation to age and sex between the 3 countries, although differences regarding education, dementia severity, and socioeconomic level were identified. Here you can see that the behavioral, cognitive, and functional changes due to social isolation among people with dementia, according to severity of dementia, were very important. So as you see, even in the mild stages, many behavioral, cognitive, and functional changes have been observed. And in terms of changes or differences according to severity of dementia, you can see that anxious, people feeling more anxious were related to more severe stages of dementia. Delusions were also more common in the severe stages of dementia, as well as obsessive compulsive behavior, hallucinations, forgetting more, appetite changes, and impaired functioning in daily activities. These changes were seen as beginning in the pandemic period. So they represent changes from the baseline or the period previous to the social isolation due to the pandemic. Similar or also behavioral symptoms were observed among family caregivers. And as you can see here, some of these behavioral symptoms were also associated with severity of dementia. For example, increased burden, a feeling of worse health, greater physical effort, more time spent with care, and loneliness, feeling more nervous, feeling more sad or sadder, and having more irritability and more sleeping difficulties. So to conclude, social isolation during the COVID-19 pandemic triggered a series of negative behavioral and clinical repercussions, both for people with dementia and for their family caregivers in these 3 South American countries. The impact of social isolation on people with dementia, as well as on their families, was not influenced by socioeconomic level. This is very important. And these findings reinforce the urgent need for social, psychological, and healthcare support to these individuals and to their families, particularly in low and middle income countries, as we have studied in this particular investigation. Thank you so much.